And part of a dentist's job is to detect disease early. When you go to see the dentist, they're checking you for gum disease, they're checking you for dental decay, but they're also checking you for oral cancer. They're looking at your mouth, looking for any abnormal tissue. And when we were trained, they focused a lot of our oral cancer screenings on the floor of the mouth or the lateral aspect of the tongue. And those areas are areas where are kind of associated with cancers that result from smoking tobacco or alcohol use. The tricky thing about HPV-associated oral pharyngeal cancers is that it's really hard for me to see back there. These cancers are typically found at the base of the tongue, way down in the back of the throat, and in the tonsillar area. So when I do my exam, no matter how well you say it's really hard for me to see back there. So some people have looked at either adjunctive tests. These are similar to the pap smear that people get to detect cervical cancer, but they haven't been able to perfect these tests yet. They're not sensitive or specific enough to be used for routine screening. So part of dentist's job is detect oral cancer, and we're not doing such a great, we don't really have many tools to detect HPV-associated oral cancer. The part that's really concerning is that, the sooner we can catch cancers, either oral or oral pharyngeal cancer, will improve the survival rate. And currently the 5-year survival rate is 65%, which really kind of equates to, which is really scary, is these cancers result in almost 1 death every hour for every day. So there's a really large burden of these diseases. And if any of you on the line have seen the last one on HPV that through the Indiana Cancer Consortium, one of the surgeons was discussing the treatment for oral pharyngeal cancer, and it's pretty devastating, to be honest, for the patient, and has lots of complications. So it's kind of bad all the way around. So where do dentists stand? Who's the leader? And people familiar with the dental field look to the American Dental Association. That's kind of the big association that dentists look at to see where should we be going. And in 2018, the American Dental Association urged dentists to support the use and administration of the HPV vaccine, and recognizing that this is a way to prevent HPV-associated oral pharyngeal cancers. Because we really struggle with detecting it, and the earlier the detecting, the better we are off. So if we can vaccinate these kids, get all the kids vaccinated, there'll be a lower incidence of HPV associated oral pharyngeal cancer. So the ADA's stance is strong support of this vaccination, but where do the dentists stand? So there was a survey, the American Dental Association created a survey to see what the general, like a cross section of what the dentists are thinking with respect to HPV. In the survey, there were 329 respondents, and they were asked specifically about, do you discuss HPV vaccination in your office? And these are some of the answers that kind of the themes that they were picking up. And it's kind of telling, these answers kind of telling to me that we need more education. A lot of it, best left to other healthcare professionals. Maybe pediatricians, I can see them fitting in there. really don't know how to address the topic. I think the big thing is they're really uncomfortable discussing sexually transmitted infection with their parents of their young patients. And then maybe the lack of an appropriate location in the office could really struggle with that. A lot of offices kind of have a more open concept where it's a little bit easier to overhear different conversations. But I really, I think the main take-home point when I look at these information is, or these results, is that the dentist really may need more education on what it means and how big of a burden HPV is. Because some of these I think we can overcome with educating. And the other part of this ADA clinical values panel was, if you were able to, would you administer the HPV vaccine? And 38% of them said that they were unlikely to administer the vaccine or really feel uncomfortable administering the vaccine. Which I kind of was surprised because, dentists, part of our job is to administer injections for pretty much everything we do. Our patients want to not avoid it, avoid getting local anesthetic. We're pretty proficient with administering injections. So providing immunization in the shoulder is probably a little easier than administering in the mouth. I don't know, I've never done it before. That's one of the critical things that, in Indiana, dentists are not allowed to administer vaccines. And that is something that is changing. In Oregon, the dentists are now allowed to administer vaccines. But, the uptake, I don't think has happened much. And there's really, really good reasoning behind these barriers, vaccine preservation. It's hard for me to imagine a solo practitioner having a vaccine fridge with all the associated documentation, working up an informed consent, really learning the protocol, and being able to do this in a timely manner, and then actually get paid for it on the back end. As you can see, the reimbursement is a really large proponent of this barrier. Why would they extend that effort if they're not going to be able to get paid on the back end? So, that's a philosophical question, I think. Is it the right thing to do, or is it going to make money? I think it's a balance of the two. But, what I was alluding to earlier is what can we do? A lot of these things require education. And I think, I applaud the Dental Association for really pressing this issue. These are just some articles about HPV-related oral cancer and really trying to educate dentists on what the information is, what's the background information, to increase their knowledge. And I included the two journal covers because in the last year there have been two of the covers that were specific for oral cancer, and in both of them, the one in the middle of the screen, oral cancer screening and smoking cessation counseling, talked about HPV, and then the dentist's role in human HPV prevention, parents' perceptions. It's talked specifically about, are patients open to having a dentist talk to them about HPV and oral cancer, and this whole thing that I think dentists are really concerned about. Well, maybe it's better for the pediatrician to talk to them or their primary care physician. And then they also talked about, things for the patients. Have the patients bring this stuff up by, advertising. How do you reduce the risk for oral cancer? What should they be looking for? So pushing from both the patient's perspective and the provider's perspective to start getting people thinking about it. So I think there's slowly getting some more momentum, like educating our providers, educating people, the patients, and starting to move the needle from my perspective. So, okay, so I was telling you that it's really important, from my perspective, it's really important for dentists to be talking about HPV. There's a lot of apprehension about it. And, even if we kind of got them, increase their level of understanding of HPV, they probably won't be able to administer the vaccine. And if they did, there's still a number of barriers. So, what can be done about it? Well, I think federally qualified health centers are positioned in a really good spot to be able to help fill this void of need. For people that may or may not be familiar, FQHCs, or federally qualified health centers, are basically, they're the safety net of people that really struggle to find accessible healthcare. They're located in high need areas. They provide a whole host of services like medical, dental, vision, pharmacy, behavioral health, and the list keeps growing. So lots of services under one roof. They're open to everybody, regardless of the ability to pay. And then they are made up of, and a lot of the decisions are made from people that live in the community. So we're really positioned in an area where a lot of the HPV burden is. And as you can see on the left, the little circles are all the health centers in Indiana. Right now there's 30, as far as I understand them, it may have been updated, but 35 health centers, 22 of which have dental services as well. So there's quite a distribution of health centers across the state of Indiana that may be able to do something about this HPV problem. So I wanted to share with you one of the health centers projects, and then I'll share with ours and show you what we're kind of planning on doing, and then what's the future. So there's a health center in New Jersey that used community dental health coordinators to educate patients on the importance of HPV. And what they did is, so community dental health coordinators are people that are usually dental assistants or hygienists that have had extra training to be able to communicate with patients about a whole host of oral health care topics. So you can say, well, why is it important for me to get fluoride varnish? Or why do sealants really help prevent cavities from developing? And this health center kind of trained them to talk about HPV vaccination. And so what they did is they had actually 8 community dental health coordinators. Our health center does not have any community dental health coordinators yet, but this health center is a little bit larger than ours. And so, but they had this nice resource for community health centers. And their baseline, they were looking at 9 to 18-year-olds. They had a cohort of 900 of these people, and when they started, they were at 12% of this pool had HPV vaccinations. At the end, I believe it was a year study, they ended up with 31% of the population that got completely vaccinated. And they did this just by using these community health coordinators, community dental health coordinators, to talk with the patients, talk with the physicians, and help coordinate those two specialties. And some of the things that they learned a number of things on what to do, and my health center is taking what the lessons that they learned and working it into what we're planning on doing. But one of the things, I took kind of cherry picked some of the lessons learned that they had, and the important ones were, conversations that position HPV as a risk for oral cancer, improved acceptance over, talking about HPV as a sexually transmitted infection, and you really need to get your kid vaccinated because this sexually transmitted infection can cause oral cancer. I think they found that when they talk to parents about that for their 9, 10, 11-year-old, that really closed people's minds on being able to get the vaccine. There's some disconnect with that. So they suggested that when you talk about HPV, we're talking about it as a oral cancer prevention and not necessarily the mode of transmission. So they also found that if you had something to talk them through with, like a brochure or an educational material, it really helped engage and lent some strength to the conversation. It's not just community dental health coordinators. They may not be the providers. There's a lot of strength to a provider having a conversation and spurring action. And I'm not sure if that kind of helped with the confidence in the recommendations or not. But then also they found that there's a lot of misinformation and lack of knowledge about HPV and what series to get them, how often, some of the misconceptions about it being safe or not safe, and really correct the messaging, not just in the dental world, but in the medical world as well. And even with the staff, the more consistent the message, the better they had their patients accepting to get vaccinated. The one thing that they did find was that a lot of patients, at least in health centers, and I'm sure that's not unique to the healthcare delivery system, that if you make a recommendation and somebody has to go do something else to get that service, there's a lot of attrition. A lot of people, they may be motivated in the dental chair. My dentist made a great case for it, but okay, now I have to make a doctor's appointment, then I got to go to the doctor's appointment and get pull them out of school. So there's a lot of steps that people, lose momentum. Their long-term, their next step, as far as they're saying, is their long-term goal is to get HPV vaccinated in the dental setting. Save them, they're already at the dentist. And that's kind of where we're taking off. HealthLinc is taking off in what our vaccination protocol is. And I was hoping to kind of describe our process without going into too many details. We have a kind of a complicated workflow that I thought would be really difficult for you guys to grasp. So I made a beautiful cartoon. So hopefully a little bit, it's a little bit cartoonish, but I think it helps get the process over to everybody a little bit more clearly. So we envision our vaccinations to occur while the patients are seeing the hygienist. The way we have our system set up, most of the kids see the hygienist first. So the plan is that the hygienist will check the electronic health record to check to see, has this patient had a HPV vaccine, or have they not? And if so, are they due? And is it the first series, second series, or third series, kind of depending on their age? Depending on what statuses they are, they would send an electronic communication to the dentist. We use Microsoft Teams at HealthLinc as a communication tool between departments. And so you'd send, it's almost like an instant message. You'd say, patient 123 needs this, needs you to talk to them about HPV. So the dentist would be able to kind of prepare themselves to go in and examine the child and then talk to the patient. One of the studies is they found that the parents or the guardians were most amenable to the dentist talking about providing a vaccination over the other staff members. So the idea is that the dentist would talk with them, answer any questions they may have, and if they were saying, yeah, okay, we can give you the vaccination today, we'll have somebody come down and administer this vaccine. Is that something you want to do? If they approve, we would send a message to the pharmacist. We have a clinical pharmacist in our group, and we chose a clinical pharmacist. I'm sure not all health centers, and if there are any health centers on the phone, they may not have access to a pharmacist. We were also considering a medical assistant. It kind of depends on everybody's health center and kind of what the right ratio is. But a medical assistant can do it, a pharmacist can do it, and hopefully that might change in the future. But so we'd send a message to the pharmacist. We have a patient in our test site. The pharmacist happens to be upstairs, so when they are between patients, when they're in the clinic and in between patients, this electronic message would be available to them. They would know where, which patient it is, and they would be able to go and check, what their insurance coverage is, what stock do we need to pull it from, are they actually due, is our electronic health record accurate? Just as a second check, they would check the CHIRP records, and then they would communicate between the pharmacist and the hygienist to say, okay, I know you're still cleaning teeth, I'm ready with the vaccination, and I'll come down whenever you're ready. So the hygienist would continue to clean the patient's teeth. When they're ready, they'd say, okay, I'm ready, come down and let's administer the vaccine. The pharmacist would come down, do all the appropriate paperwork, vaccinate the kid, and everybody would do their charting and documentation to make sure we have accurate records. That's a lot to put in place in an hour, and that's one of the areas that we're still working on, trying to figure out how is this going to be doable and what hurdles are we going to run into. We're starting our first test. There's a number of tests that we have to do. We're starting our next test, or actually our first test this coming Monday. So that the ability to come and give updates, I'd be happy to do that. But right now we're kind of working through this. So I'm optimistic that we are going to run into some problems, delays, like billing, communication with the parents, but we feel like this is another opportunity. If they're seeing the medical department, they get one vaccination, they may not ever come back to the medical department, or they may miss some appointments, and they tend to come see the dentist. So overlapping between the medical department and the dental department, will be able to complete their series before as quickly as possible. So the future state would be we would be able to have the dentist actually administer the vaccine. And there is some work that where we want to change the Practice Act for dentists to be able to administer vaccines. And this is some of the legislation that passed the House of Delegates for the Indiana Dental Association. And the Indiana Dental Association supported allowing dentists to administer vaccines. So we're going to be working with the Immunization Coalition and the IDA to kind of push that legislation forward to change the Practice Act. And, you know, the exciting part about this is, yeah, HPV vaccination would be a great way to do this. It would also be a great way to administer flu vaccine. It would also be a great way to administer the C2 vaccine as well when that happens. So there's lots of different areas that, you know, dentists can kind of get involved with in it, and federally qualified health centers are a good starting point. We may be able to kind of really help out the system, not just dental decay or gum disease, but we could help prevent other diseases as well, and really truly become integrated. So with that, I'm a little bit ahead of time, I see, but I'd be happy. This is kind of where HealthLinc is on the northwest side of Indiana, but I'd be happy to answer any questions you may have or add some clarity I may have overlooked. So.
Thank you so much, Dr. Zeckel. And if anyone has any questions, feel free to put them in the chat box or come off mute shortly. We actually did have a couple message to me that I wrote down, and one you kind of touched on. They were curious about your organization's vaccination rates, but you said you're just getting started on Monday. So just to touch on to that, how long has this planning process been for HealthLinc?
So it's surprising. There's lots of different challenges. Even though we're under the same roof, we share the same electronic health record. Like when I see my patients, I document right next to their pediatrician. Getting everybody on the same page is quite a challenge. You know, it's surprising that even though the vaccines are just up one flight of stairs, getting them downstairs, there's lots of steps involved. So we've been planning this for at least 6 months. I anticipate the first phase where I call it the test team. The test team will take 3 months where they kind of refine the process, build up, you know, run into problems, figure out how to overcome those problems, and then adapt the process. The goal after the first phase is to have something that I can go to the next set of dentists, hygienists, and pharmacists to say, okay, this is how you do it. We've worked this problem out, and so we'll be successful, not just at one location, but all 5 locations.
Thank you. We had another question about, I think you mentioned in New Jersey that their office, they had a dental coordinator of sorts, and they were curious how common that staff person is.
It's a newer training. I think it was, you know, they've started doing some training 2017 or 2018, I believe, when I first heard of a dental community health worker. And I think, you know, it's a really positive thing that they can do. It's a great asset because when I talk with new providers or people that are interested in coming to work for us, I always talk about, you know, a lot of our patients, the biggest time people kind of get upset is when they just don't understand. And I think that's a big barrier for a lot of our patients, is they just don't understand some of the details or intricacies that we take for granted as dentists. You know, I know that my staff have told me, you know, that patient really didn't understand what you were telling them, but I straighten them out for you. So those people are trained to talk with patients and help translate what I'm trying to say into some action.
Thank you. And I had one more that was messaged. You mentioned legislation being pushed in Indiana, and what is the current status of that legislation?
So basically the Indiana Dental Association supported that dentists can administer the vaccines. The next steps are that we have to be able to change the Practice Act and enact legislation to be able to actually administer. you know, that's the first hurdle is to, you know, have the association say that's a good idea, we should do that. The second stage is making it legal for us to do, and then training all the dentists how to do it, or you know, kind of getting us, you know, multiple steps along the way. But that was, I believe, that was just in June, May or June, I believe, of this year. So.
Thank you. That's all the questions that I had submitted. Are there any other questions for Dr. Zeckel while we have his expertise here? Feel free to come off mute or put any last questions in the chat. All right, with that, thank you so much, Dr. Zeckel, for joining us today and updating us in some of the statistics. And I'll be really curious to hear how it goes within your organization on Monday. So I'll be excited to hear some follow-up. So thank you.
Thank you very much for having me. Sorry, I talked a little faster than I thought I was going to. So
that's all right. I know everyone always appreciates a little time back in their day. So no problem.
So that was my present to everybody on the phone.
Thank you. Everyone have a great day.
All right. Bye now.